Well, thank you, Chairman Herger, for holding this hearing today. And monitoring Medicare solvency is an important responsibility for our committee, and we welcome the opportunity to discuss this with our public trustees today. The trustees' report shows a Medicare program that's been significantly improved by enactment of the Affordable Care Act. Beneficiaries are also enjoying new benefits as a result of the law, and without the health reform law, insolvency would be projected at only 5 years, a full 8 years less than the 2024 date reported by the trustees. It's important to look at the trustees' report in historical context. Since we've been projecting Medicare solvency, those projections have varied widely. In 70 and 71, just before I got here, the program was expected to only last 2 years. At the end of the Clinton administration, it had a robust 25 years of solvency. In the past 45 years, whether solvency projections have been 2 years or 25, we've never allowed Medicare to become insolvent. And why? Because Congress has always acted to make changes to the program to avoid that outcome. That's our job, and I think we've done it pretty well. I'd also note that no private health insurance company, and we know our colleagues on the other side of the aisle would prefer that Medicare be handed over to them, none of those companies are measured with regard to their projected solvency over the next 75 years, or even 1 year. They move quarter by quarter with the market. My Republican colleagues will focus on the solvency date having slipped 5 years from last year's projection of 2029. We know that this slip is primarily due to the economic recovery being so slow, which directly affects Medicare's financial standing. I'm not sure why the Republicans are focused on the issue of Medicare solvency at all. They've already voted to end Medicare several times. The Republican position is clear. Republicans don't believe it's the role of the federal government to guarantee health benefits to senior citizens and people with disabilities. Republicans would prefer to repeal the health reform law and end the delivery system reforms, and reforms that the trustees' report highlight as showing real promise for controlling Medicare spending growth. Even more in the future, Republicans instead want to provide Medicare beneficiaries with a voucher to purchase more expensive private insurance that may or may not be affordable or cover the benefits they need. There's no doubt that an underfunded voucher would save the government money. You know, Medicare becomes a lot cheaper when you destroy the program. The message to take from this year's trustees' report is that the Affordable Care Act significantly improved Medicare's financial standing. There's always more to be done, and we must work together to protect and improve Medicare, not end its guaranteed benefits for senior citizens today and tomorrow. And with that, I yield back to my friend from California and look forward to the testimony and discussion to come.